hand, wrist, arm, and shoulder pain. These issues can cause problems in your everyday life, and our next guest is here to help. Welcome Dr. Tyler Luthwinger from CONA to tell us a little bit about some of the issues and conditions that they treat and how you got into it. Dr. Luthwinger, thank you so much for being here with us.
Thanks for having me.
Yeah,
nice to be here.
So we're reading your background. We're like, oh, he's done some things.
You had me at the Bulls.
Yeah, Dartmouth grad, all these great things. So talk a little about how you got into it and a little bit of your background.
Yeah, so originally from upstate New York, Syracuse, and actually moved to Vermont for high school to attend a ski racing academy.
Oh, that's baller. Love it. Yeah.
Throughout my skiing career, I kind of suffered multiple shoulder injuries, shoulder dislocations, ultimately had a few surgeries, and then by the end of my skiing career in college, sort of redirected my focus, decided to do all my pre-medical courses a year late after college, and then applied to medical school, wound up in Chicago at Rush, where I did my medical training, and then went on to orthopedic residency at NYU in Manhattan. And then from there, kind of kept up my love and interest for shoulder and upper extremity injuries, did a year shoulder and elbow fellowship at the Rothman Institute in Philadelphia, and then followed that up with a trip back to Chicago to go back to Rush for a hand upper extremity fellowship.
Well, we're glad your resume is very small. You don't have
just a small resume. We're glad that it led you.
That's an impressive resume for sure. And I love that the skiing background and you seeing a lot of these injuries that you now treat for people. It is a personal thing for you having that connection. You've seen it.
It is very much so. I think having been through a lot of the recoveries, I mean, ultimately, total of 4 surgeries in my personal history. So I've kind of been through it, and I think that kind of helps me relate to patients and helps me coach them through kind of what to expect. And, it does. It makes it a personal experience for me.
What are some of the main things that you're treating right now?
So, I would say in terms of shoulder injuries, the most common things I see patients for are injuries and pain related to the rotator cuff.
Yep.
The rotator cuff is a group of 4 muscles that originate on the shoulder blade, and they attach to the ball of the shoulder through 4 different tendons. And those muscles and tendons help you position the arm in space, particularly reaching away, out from the body, and overhead as well. And injuries to the rotator cuff can come on from just kind of chronic overuse and wear and tear, or from acute injuries such as a fall or a shoulder dislocation. And in the more chronic, insidious setting, a lot of the patients, by research, 70%, can actually make considerable improvements with just therapy and injections and avoid surgery.
And a lot of people, that's the big thing, is a lot of people don't want to go through surgery, they don't want to do any of the medicines and things like that.
Right.
But you said that there are some things that you guys can do that maybe prevents them from having that surgery.
Yeah.
What are some of the other conditions that you guys, a lot of people talk about carpal tunnel.
Carpal tunnel is definitely another very common one. So carpal tunnel itself, anatomically speaking, it's a small area at the base of the palm, and it's housed on 3 sides by bones. The floors and the walls of the carpal tunnel are just restricted by bones, and then the roof is covered with a thick ligament. Underneath that ligament is one of the main nerves that go to the hand, along with our tendons that control flexion of all the fingers and the thumb. And there are certain things that over time can contribute to tightness in that area. Typing as a common complaint. Certain activities that cause you to keep your wrist in a flexed or extended position for a long period of time. Certain occupational exposures, such as vibratory things or heavy manual labor, and then
I've known a lot of piano players that have had things.
I've seen that once or twice as well. And then there are just other, factors that are multifactorial. Age is one. It's probably more common in females just because of the more small anatomy. And then there are medical conditions, diabetes, thyroid issues, rheumatoid arthritis, different things that can also contribute to tightness in that space.
Never thought about those connections of pre-existing conditions that may.
Yeah.
Never thought about that.
And it's crazy too how certain pains, like you may something be wrong here or here, but then you're feeling it here.
Yeah, well, in terms of carpal tunnel, I mean the pathology and the compression on the nerve happens at the wrist, and that typically manifests as symptoms in the thumb, index, and middle finger.
Yeah.
But when we work up patients for carpal tunnel, there are tests that we can perform to see whether there are other sites of nerve compression starting from the neck going down into the arm, so that we can kind of counsel patients how much improvement they may expect from carpal tunnel treatment based on nerve compression at this site versus any other nerve compression sites that they may also
That's
have.
why they want to go to CONA.
Right.
Do we have to have a referral to come see you? How do we sign
No,
up?
I mean, so we accept new patients without referrals. They can just call and schedule a new appointment. We also have a walk-in clinic for acute issues. If patients have any acute injuries or something, they're having trouble getting an appointment, they can always call, and we have walk-in clinic 5 days a week at our 3 locations.
Perfect. Which location are you at? Do you go to all three?
I go to all 3. I'm mostly at the Greenville location, but I also see patients in the Duncan location and the Spartanburg location.
Awesome. Are you still skiing?
I haven't been in a couple years, but I have 2 young boys who I need to get out there, so I think by the end of next winter, they'll be old enough.
It'll be time.
And they'll be playing, yeah.
See, I'm saying you stick to the blues and you just pizza. And
Yeah. Pizza, French fry, pizza,
yes,
French fry.
right? See, yeah, that's straight down. That's for the youngsters.
Yeah.
It's not. Thank you so much
Thank you for having me.
being here. Very fun.
All right.